Welcome to Hospital Rounds, our latest video series from Hillsdale Hospital. Just as every nurse and doctor have to round on their patients to ensure timely care and keep them up to date on their care plans, so we are rounding on our units, our departments, our centers to keep our community in the know and up to date on your local healthcare. I am so excited to be in the beautiful Betty Yockel Birthing Center today with Dr. Sarah Spencer.
Hi.
Welcome.
Thanks for having me.
Yeah, thank you so much for letting us come into this beautiful center. It is one of my favorite places of the hospital, just so heartwarming and just great staff. You have a wonderful team here. So would you please introduce yourself to the community, Dr. Spencer?
Hi, everyone. I'm Dr. Spencer. I'm the medical director of the obstetrics and gynecology program here at Hillsdale Hospital. I've been here for 3.5 years now, and it's a great place to work.
Wonderful. Yeah. Thank you so much. We're going to take a little tour, meet some different people, and we'll have a longer conversation with Dr. Spencer in a little bit. We are now in the waiting room in the birthing center. I'm here with Jennifer. Thank you so much for being here, Jennifer. Can you introduce yourself?
Hi, I'm Jennifer. I've been a labor and delivery nurse here for 11 years.
Perfect. And what is the role that a labor and delivery nurse has for a patient in the birthing process?
We support patients during triage visits, non-stress tests or NSTs, and during labor and delivery, we will support the mother and the significant other and help deliver babies.
Absolutely essential to the process. We would be totally lost without our nurses, and we were just so grateful for your work here. So we're in the waiting room. What role does this room play? And let's talk a little bit about guests to the birthing center who might be coming to visit a mom.
Yep. We might have your guest wait in here. We might have you wait in here if we're waiting for a room to open or become available. Sometimes maybe you would like for your children to come wait in here with your mom or your grandpa or something like that during the labor process, just so they're not in the room the whole time.
Absolutely.
And that's what that would be for.
Yeah, that's wonderful. It's so great that we have this space and we have just really, some great support staff to support the patient's vision of what they want their birth to look like, and the safety of both mom and baby. So thank you for the work that you and your team are doing here.
Yep, you're welcome.
We are officially in a labor and delivery room. This is really exciting. This is where the magic happens. So Dr. Spencer, can you walk us through the different elements of this room?
Sure. So we're kind of over by the computer monitoring area right now.
Okay.
So we have computers in all of the rooms that can show us babies' heart tones and mom's contractions and all of that. And the nurses can chart on here.
Okay.
This is a fetal monitor.
Okay.
So when we have it all turned on, this is how we capture baby's heart rate and watch mom.
Yeah.
And it prints out a nice little strip.
That's great.
For us to look at.
All right. And then we have lots of instruments over here, everything that you need for an emergency, I'm assuming.
Right.
And then the bed here.
Yes.
Walk me through the different elements of our birthing beds.
Yeah, the birthing beds are great. They're very mobile and we can get people into lots of different positions.
Oh, that's wonderful.
They move up and down. The foot of the bed comes off. We have, stirrups to help people rest their feet if we need to.
Okay. And do you have to stay in the bed when you're laboring, or can you go wherever?
No. We support patients really moving around and kind of making labor what they want it. And so we encourage movement. We have some tools over on the side of the room that we can talk about that kind of help with that.
Okay, that's great. That's great to know that there's a lot of freedom in the way that you want your birthing experience to go.
So we have different birthing balls that people can sit on, or we have, these are kind of funny looking, but they're peanut balls that we kind of help position patients on their, or moms on their sides and helps babies move down during labor. So,
that's wonderful. And what is this?
Yeah, so we have an exciting new pain relief machine that we have implemented recently. It's called Pronox. It's nitrous oxide. So it's a gas that our laboring moms will breathe, and it helps with reduced pain during labor.
Wow. Wow. That is so cool. But I mean, I'm assuming just state-of-the-art technology. That's wonderful. So tell me about just kind of the birthing experience in general. What is your vision? What is the center's vision for a birthing mom who comes in and is laboring and about to give birth?
Yeah, we want to give our patients we want to follow their vision the best that we can. So we support our moms in their birth plan. as long as we can in a safe way.
Yeah.
Yeah.
That's
So,
wonderful.
you know, our nurses are here kind of frontline helping patients get through labor. And we have doctors and midwives now. We're starting a
Wonderful.
great new model where we're
Yes.
supporting
Tell us
more
about that. That's
midwives.
so exciting.
Yeah. So our future model is going to be mostly midwife centered, where
Yeah.
our midwives help our patients through labor and the
Yeah.
delivery process. And we have doctors as well for
Yeah.
backup and when we're
Yeah.
needed to assist in the higher risk cases.
Wonderful.
Yeah.
So what is I feel like there's a lot of different kind of assumptions about midwifery, but what is the training that a midwife receives and how is that different from a nurse and different from a doctor?
Yep. So midwives start their training, I believe they get a bachelor's degree,
Okay.
and then many nurse midwives will work as labor and delivery nurses first.
Okay.
And then they go to midwifery school. So
Okay.
that would be a certified nurse midwife
Okay.
training.
Wonderful. And what is kind of the role that they have that we're trying to take better advantage of to kind of give better access to our community?
Yeah, midwives are a great support for moms. Since they went through some nursing training to begin with, they have that background as well as the laboring, you know, care of moms. So they're great at supporting moms through labor and, you know, doing more technical things as well.
Okay.
Yeah.
Wonderful. So let's talk a little bit about beyond the birthing experience. You know, we're OBGYN, so that's obstetrics and gynecology. So, you know, we have a beautiful OR here as well, and that's just around the corner. That's so great that we have access to that. So obviously emergency C-sections, emergency hysterectomies, things like that. But what else can we do with that OR and some of the other procedures that we have in our program that people might not know about?
Yeah. So we have our one OR down here on labor and delivery that we use just for C-sections. So scheduled C-sections or emergency C-sections if those have to happen. But as physicians, we provide a full range of care for our gynecology patients. So we do anything from like minor biopsies or hysteroscopies or DNCs all the way up to hysterectomies, removing uteruses.
That's amazing. And you work in tandem with the OBGYN office at Hidden Meadows, correct?
Right.
Okay.
Correct.
Okay. That's wonderful. I love seeing that continuum of care. And I've talked to so many patients who are just so happy with their experience here. The last question I wanted to ask you was about doulas. So doulas are different from midwives. Tell us about how, if a patient wants to have a doula, how that kind of fits into the care that we provide.
Yeah, we love doulas. Doulas are great. They're great support people for laboring moms. So doulas go through a training program. They're not nurses, they're not midwives, but they support moms through labor.
Okay.
So we welcome doulas here and encourage
That's great.
patients to seek out
That's
doula
wonderful.
care.
I know that we have a lot of doulas in our community who we work closely with to make sure that the patient has the absolute best experience that they can. I know I said it was the last question, but one more question. Let's talk about the worst case scenario when there is an emergency and either baby is at risk or mom is at risk or both. What is our response to that? What are the tools that we have in place to respond to those emergencies?
Yep. So we have always an on-call OBGYN, whether we have a midwife here on call, there's always a physician to back up the midwife. So we would help with any emergency C-section or emergency deliveries. We have anesthesia in the hospital. They are always on call 24/7 for us. So we can always call them in quickly to help. If we need any.
That's wonderful. And I know we have just an incredible rapid response protocol, and we have really wonderful devices like the Jada device I've heard of that helps stop hemorrhaging. Can you tell me about that?
Yes, that's one of my favorite little tools that we have. The Jada, and I can show you one
That'd be great.
if we want to see one, but the Jada is basically a tube with a loop on it, and it gets hooked up to vacuum suction. We put it inside mom's uterus after the baby's born if mom's having increased bleeding, and it works really well to control bleeding.
So I've heard that with a Jada, before you use that, if there's increased bleeding, you know, you might do some of the traditional uterine massage, that kind of thing. What is the point where you kind of realize, okay, we need to stop doing that and move to this device before it gets more severe and you might need an emergency hysterectomy or something like that?
Sure. Of course, a hysterectomy would be like very last resort. That would not be a great situation.
For sure.
But I wouldn't say there are specific criteria that we use to qualify what a postpartum hemorrhage is, but we never want our moms to get there. We don't want moms to bleed excessively.
Absolutely.
So part of our protocol is to give moms Pitocin after delivery as a standard that's recommended by ACOG.
Okay.
It's called active management of the third stage.
Okay.
So we give moms IV Pitocin, uterine massage, and usually that is what moms need.
Wonderful.
Yeah. We have other medications that we can give as well to help help with bleeding.
Okay.
And we usually use a combination of those things, including the Jada. So this is the Jada device.
Okay.
It's really soft and flexible. This loop is the part that goes inside the uterus.
Okay.
There's a balloon here that we blow up with fluid that kind of helps seal everything. And then the vacuum gets attached here.
Okay.
And it's really great because we can see exactly how much bleeding moms are having, and we can keep track of it very accurately.
Okay.
This is a great device that we have, so I'm glad we get to work with it.
That's so wonderful. It's great that we have access to technology like this to really give us the tools that we need to provide just the best birthing experience possible. Thank you so much for the work that you do here and the work that you do with our team. I'm so excited about this new model of staffing that we have. It's so exciting. We love our midwives. We love our OBGYNs, and you guys just take such good care of the moms and the babies in our community.
Well, thank you. We love taking care of people and hope everyone has a positive experience. Yeah.
I'm excited to welcome as a guest Jason. Welcome, Jason.
Hi.
Can you introduce yourself to our community?
Sure. So my name's Jason Flowers. I'm one of the managing partners at Challenge Anesthesia. I've been at Hillsdale Hospital providing anesthesia services among some other hospitals for the better part of 3 years.
Yeah.
I'm also the director of general anesthesia services at Hillsdale Hospital and take a good part of the call. So there's about a 40-50% chance that if you have anesthesia services here, you'll see me in one capacity or another.
Perfect. So typically, we're used to seeing you in the surgical unit, but you're also down here in the birthing center sometimes. Tell us about anesthesia's role in the birthing center and the birthing process for a mom.
Absolutely. So while I can't speak to the birthing process in entirety, the anesthesia department is very interested in providing the most exceptional experience possible. So there's always pain associated, discomfort associated with labor, and we assist with that. So we're happy to offer epidural services, subarachnoid blocks or spinals.
Okay.
And if a patient needs a C-section or has a planned C-section, we monitor the patient, make sure they're safe for the entirety of the procedure in the perioperative or pre-procedure area and the post-operative procedure area.
Okay.
So we'll monitor the vital signs, make sure the patient's doing well, communicate with the surgeon, and make sure the patient's completely comfortable and safe throughout the procedure.
Yeah, that's great.
Yeah.
So I know that there's a lot of kind of conversation around epidurals and whether or not it's a good choice. And I know that we kind of give the patient some freedom in deciding what they want to do. Can you talk about that and what we kind of advise your patients to take into consideration?
Absolutely. So epidurals are completely voluntary. So it's not something that has to happen. But they are the gold standard and still referred to as the gold standard for pain control during labor and delivery.
Okay.
So we offer that to the patients, but every patient that we offer that to, we offer education related to the risks and the benefits.
Gotcha.
And every procedure has risks associated with it and benefits. The benefits are amazing pain control when everything goes perfectly well. And the risks associated can be low blood pressure, nausea, and they can be more severe. So we always, in getting a consent for that procedure, if that's what the patient wants, we make sure the patients are highly educated before they undergo any invasive process. And if they elect not to have an epidural, it's not like we back away and have no interest in the patient's comfort. Then we still make sure that the patient has every resource they could have to have a comfortable labor and delivery as much as possible.
Wonderful. Well, thank you so much for the work that you're doing. I know your team does a fantastic job. You've taken care of some of my family members, and you guys do a wonderful job for our patients.
It's a very nice privilege, and we're happy to take care of any member of the Hillsdale community.
Wonderful.
We really appreciate it.
We are now in a totally new space. I'm here with Hillary Zimmerman. Hillary, can you introduce yourself?
Yes. Hi, I'm Hillary Zimmerman. I'm the clinical nurse manager of the obstetrics department here at the Alfred K. Pediatric Birthing Center.
You've gone on a lot of our radio and
Yes.
Facebook Live shows and things like that. We're really grateful for your engagement. And you probably see Hillary just super engaged in the community at all of the events. And you do so much for our patients and the center to keep it running. So thank you for all you do. So where are we? Tell us about the space.
Yeah, so we are in the Well Baby Nursery. We typically don't have a lot of babies in here because they're in with their mamas, but sometimes they have to come in here.
Yeah, that's wonderful. So let's talk about the bassinet. So what are the kind of elements that we have ready for a baby once the baby is born?
Yeah, so we supply almost everything for babies. We have really good partnerships with Helping Hands, the Great Start Collaborative, Kappa. They give us sleep sacks. We give moms diapers and wipes and all sorts of stuff.
That's wonderful. That's wonderful. And what are the other kind of tools for medical safety that we have in place to care for a baby once they're born?
Yeah, so in the rooms, it's not pictured here, but we do have warmers and we have respiratory supplies. We are all trained and equipped to do newborn resuscitation if necessary with our pediatrician.
Dr. Ellis comes in and supports those babies and makes sure that they are set up with great care right away from literally day one or hour one.
Yes, moment 5.
Yes, which is great. What is kind of the vision that you have and that our center has for babies for those first few moments of their life?
Yeah, so we know how important it is for babies to be with their mommies.
Yeah.
So if we don't have to do anything, we are just here to support. So typically the first hour or 2 of life is a baby right on mama's chest. And us just supporting, making sure that they are okay and transitioning well.
That's so wonderful. I love to hear that. And I know those moments are absolutely pivotal. So if a baby does need to be in here, if they have a medical need that is a little bit more pressing, can mom come into the nursery and be with them?
Absolutely. Absolutely. So we're really good at getting creative. And we can put them on different beds if mom, for some reason, maybe had a C-section and she can't get up and walk right away. We'll pop her on a different bed, maybe a wheelchair, and we will wheel right into the nursery.
That's wonderful. So let's talk about what's over here that kind of provides some more advanced support for our babies.
Absolutely. So respiratory has an entire setup. We can do nasal cannula oxygen for babies that maybe don't need a ton. Or we can do more advanced support. It's called bubble CPAP. And get babies transitioned. We'll typically try and keep them here for 6, 8, 12 hours to see if we can get babies to transition before maybe having to look at transferring to a different facility.
Gotcha. And I know that our respiratory team is really essential to that. So they'll come right on down, which is kind of great to have a little bit of a smaller facility where respiratory is just 2 minutes down the hall. Phone call away. They get here really fast and they just are, excellently trained and care for baby moms so well. So that's great to hear. Well, thank you so much for everything that you do here. I do want to ask, last question, what if, mom wants and baby wants visitors to come to see the newborn and to celebrate? What are kind of our policies around that?
Yeah, so typical visitation is a support person, a significant other. When we're not in restrictions, so flu season, we allow siblings to come up and visit, healthy grandparents. But obviously when it's flu season, sometimes we do have those restrictions and those are announced.
Announced on our website, on our Facebook, on the news, everything. And then I know that, usually a mom will need to approve a visitor when they come in just to make sure that mom wants that person in the room, just so that it's their tailored, comfortable experience. And that's really wonderful. And we do ask that you be healthy when you come visit.
Yes, please.
Because I know that mom and baby are really vulnerable during that time and there's so much going on. So,
so really, as long as you're healthy and mom is approved, we welcome anyone.
That's so great. That's wonderful. Thank you so much.
Yes, you're welcome. Thanks for having me.
Thank you so much for joining us today on our Hospital Rounds video of the Birthing Center. We love having you along on these videos as we explore our units and round on our staff and make sure that our community is connected to what we're doing here at Hillsdale Hospital. If you are interested in learning more about our birthing center or prenatal care, anything that's part of this program, you can go to hillsdalehospital.com/OBGYN. We have some exciting announcements about this birthing center coming up very soon, so stay tuned for those. Give us a call if you have any questions at all, and we'll look forward to connecting with you again soon. And until then, remember, rural health strong.